As states lift restrictions a year into the pandemic lockdowns, are some of them moving too quickly? Joining us now, Dr. Tom Frieden, former director of the Centers for Disease Control. Doctor, you just heard Governor Hutchinson talk about lifting mandatory restrictions in his state. You see what the governors of Texas and Mississippi are doing, both on restrictions for businesses, and they are also lifting the mask mandates this week. Your reaction to all of that?
Well, first off, I think, Chris, it is true. We are really sick and tired of this virus, and there's a lot of good news coming. More vaccines, more people getting vaccines, more options for vaccines, and really good data that vaccination is making a big difference. So I would make a big distinction between reopening the economy and lifting mask mandates. One of them you can debate, the other is simply wrong.
Well, explain that a little bit. Clearly you think that opening businesses is debatable, but lifting the mask mandates is flat wrong?
That's right. And this is the way to think about it. There are a lot of harms to closing businesses, not just economic harms, educational harms when it comes to schools, personal hardship, health harms from people not having work. So it's really important to get our economy open again as safely as possible. Now, I wouldn't necessarily open everything. For example, an indoor stadium with people coming from all over, that's a really bad idea. On the other hand, masks, you know, the only freedom a mask inhibits is the freedom of the virus to spread and kill people. Masks work, mask mandates work, and lifting mask mandates is very dangerous, particularly with the risk of more dangerous variants emerging and spreading.
But let's talk about this, because this isn't just Mississippi and Texas. There's a push in this area across the country. I'm going to put up two maps for you to take a look at, Doctor. The first one is this week, 16 states, all run by Republican governors across the South and the Midwest and some of the Rocky Mountain states. 16 states, all run by Republican governors, will either have lifted mask mandates or never had them. And all 50 states, all 50 run by Republican and Democratic governors, will be either mostly or partly open for business, and some of them at 100% capacity. Is that, clearly on the mask, you think it's too much too soon? On the opening businesses, are you concerned that that's moving too fast, particularly 100% capacity in gyms and restaurants and bars?
Well, interestingly, Chris, those two things are related. If you keep a mask mandate in place, you'll be able to open more and be more likely to keep it open without risk to people, not just other customers, but the workers there as well. I do worry about restaurants and bars where people may be speaking loudly without masks on. And you really do have to focus. You know, the governor said, well, if you don't want to go into a restaurant where people aren't wearing masks, you can go to a different restaurant. Not if you're the waiter. If you're the waiter, yeah, you can wear a mask, but you're much safer if the customers wear a mask when they're not eating, obviously, and you wear a mask. So mask mandates are a way of preserving our health and our economy.
Doctor, as we said in the last segment, President Biden is coming down pretty hard on these governors who are relaxing restrictions. His famous phrase this week, Neanderthal thinking. But the day after, Greg Abbott, the governor of Texas, noted that with a lot of people right now coming across the border illegally into this country, that 108 people who had been released in Brownsville, Texas, had tested positive for the COVID virus. And Governor Abbott continued on with this. Take a look.
The Biden administration was exposing Texans to COVID. That is Neanderthal-type approach to dealing with the COVID situation.
Doctor, is this the right time to be relaxing immigration restrictions and allowing more people to come across the border and more people to be released into the country when you're in the midst of a public health crisis?
Well, let's get the numbers straight here. The United States has more than 50,000 cases a day diagnosed, and probably 2 or 3 times that many actually occurring every day. The vast majority, 99.999% of the infections spread in the U.S. arise in the U.S. Let's focus on getting our house in order, and we can do that by masking up, doubling down on protection protocols, vaccinating the moment it's your turn. And as we do that, Chris, over the next few months, we will get to a much safer situation. We will get to a new normal. But I think masks are going to be a part of that normal for many months to come. That's the sensible thing to do to get our kids back in school, people back to work, and our economy moving again.
But you talk about the fact that we're headed in the right direction. I want to put up some video on the screen because, as you well know, this is spring break time, and there are a lot of young people who are flocking to Florida, congregating on beaches. This is one of the more sedate, this is a better picture of people in bars at spring break. Does that worry you? Is this your worst nightmare?
It does worry me, Chris. What we've seen every time there's been a holiday with people traveling and mixing, we've seen a big surge in cases after. Right now, the main question that we have to know is there going to be a 4th surge in this country or not? We've had 3 deadly surges. Will we have a 4th? And the answer to that is something we can control by masking up and avoiding sharing indoor air with people not in your household.
Dr. Frieden, thank you. Thanks for joining us. Please come back, sir.
Thank you.